today I'm joined by Oliver Soriano, who, as well as being our chief nurse here at LSCft, is also the first nurse from the Philippines to take up a chief nursing role within the NHS. So really making history, and it's fantastic for Oliver, but really good for us as well. So welcome, Oliver.
Welcome, and thank you.
I suppose it'd be great, Oliver, just to start a bit about your career. What made you go into nursing? What made you go into mental health nursing? What made you come over to the UK? And just a bit about your career. It'd be fantastic to know.
It's always good to actually share this experience because I always feel that nursing in the Philippines has not been a profession. It's more about your advocacy. I will say the one who actually influenced me is my grandmother. My mom was actually living in Athens at the time in Greece, and it was my grandmother who was looking after me. And with her, that nurturing, kindness, caring, loving value that she got helped me to look into what nursing is. Never thought that there's a career such as nursing. So until my best friend Virgilio was saying, let's do nursing because we can actually graduate and we can go to Canada. Because at that time, he's got an auntie who was actually sponsoring him to do the nursing course.
Oh, okay.
So when I thought I'm going to do some nursing course because I want to be doing this with my best friend. And we got into it. My brother was very opposed of me doing nursing because it's normal in the Philippines that profession like nursing is not being seen as a profession.
Okay.
So they were saying either you have to be an engineer or an accountant. And I thought well, that's not me. So I really I would say pushed that I'll do nursing. My grandmother was just just do nursing. So after 4 years doing the degree program in the Philippines, as a nurse, you're not identified as an RGN or RMN. You are a registered nurse.
Okay.
Within that placement, I had a 6-month placement in the National Center for Mental Health. And that is where I had the best experience in my college years.
Okay.
And they always say to us when we were doing our nursing course that mental health is not the best area to do because you don't see the outcome of what you do. Because once someone is mentally unwell, that's the word that we use, they're gonna be kept in the hospital forever.
Wow.
But when I was doing my nursing course and doing my 6 months placement, I was able to link up with this patient and was doing a lot of integration and engagement. And one of the things that I've learned from my teacher at that time is do this milieu therapy, all art program that we can actually do, singing, writing, painting, and everything. So I was with this patient for almost 3 weeks.
Okay.
And soon after, I think before I finished my placement, he sang the song Moon River.
Okay.
And then after he finished singing the song, he says this is my first attempt to actually sit with someone to know what my problem is and being understood.
Wow.
And he just said a big thank you, hugged me, because again, in the Philippines, the stigma of being mentally unwell, everyone thought that you're just going to catch it.
Wow.
So that's how bad the idea of what mental health, the stigma that it comes with. And when he did that, I think there was this feeling in me that oh wow, this is where I want to be.
Yeah. Found you calling into
my calling. I just I like mental health, and that's where after I finished my degree, I thought let me progress, do my master's in mental health, because that's where I thought I'll be able to do more. I think in the Philippines, as you are a registered nurse, I was able to work in A&E department. I was able to work in endocrinology side. So it was good for me to have that skills, the physical health skills, as well as the mental health skills. And when I came in the UK in 1998, I thought the offer at that time, I remember, is to have a placement in an older adults ward.
Okay.
And I says why not? I says I'll be keen, I'll be interested, I'll be happy to do that.
And was that in a physical older adults ward?
It's a mental health ward.
Mental health older adults ward.
It was a mental health ward. So we were the first 27 Filipino nurses that was recruited in September 28th, 1998. The first 27 that UKCC have decided, like, let's trial bringing Filipino nurses here in the UK, and if they pass the adaptation period, then we will get more Filipino nurses.
Okay.
And normally the adaptation period is like 6 months.
Oh, wow. Okay.
So when I first came in, I think, like, because my background as well, like, background in teaching. So during our induction period for 1 month, the then CEO of the trust actually spoke to me and said to me that, like, oh, Oliver, we have to actually move you from your older adults mental health placement. We want you to actually go to the acute.
Okay.
Acute male ward. And it's just like, oh my God, I probably have done something wrong. And then I realized, kind of like during that period, the then CEO said to me that, like, oh, because it seems like we can develop you.
Okay.
That we can harness your skills about the work that you've done in the Philippines. You're very good in your general physical health care. And then we can actually support you on that. So I thought I was being punished going to, like, the acute adult instead of older adults, because I said, like, my heart will be in the older adults. But throughout that journey, what actually kind of like kept me being in the mental health, and everyone who will be like listening to this will know that, like, in the general setting, there's a lot of Filipino nurses working as a general nurse.
Okay.
But in mental health, there's very little of us.
Oh, okay. Okay.
So, but like, because I was, as I said, like my feelings, like, this is where I want to be.
Yeah.
Mental health is kind of like the specialist area that I want to stay. And that is all, again, because of, someone said this to me, and this is like a value, like my mom says, like, just using your therapeutic self, using your compassionate way of talking, you can actually help someone recover. And that's more powerful of, like, giving medication.
Yeah.
And I thought, kind of like, having that power of being able to listen, to speak to individuals, to kind of like help them in their recovery, I think it's more powerful. That's why I love mental health. And it's something that I'm kind of like always say to everyone, mental health is the best of like nursing profession.
That's brilliant. And how, so now you're our chief nurse, which is fantastic, is brilliant. What, I suppose, your ambition for nursing and quality within LSCft? Where do you see us going? Talk to me a bit about that.
I think my vision about, like, nursing and how care should be delivered, I think always kind of like focus on, like, what the patient needs and how we can actually strengthen that by linking up with the family, linking up with the carers, linking up with the community. I think my vision, I've got so many vision, if I can say. I'll start with the patient care, because, like, my vision is to kind of like ensure that, like, our patient receives the best possible care that they can receive from clinicians. And part of that is starting with, like, understanding the individual. My challenge being in this country for the past 26 years, like, we always talk about holistic care. And when I first started working in the King's College Liaison Service, I always feel that there's always this challenge that, like, if someone comes into, like, if someone's triaging a patient and the patient is actually crying, they always think like, oh, this is mental health.
Okay.
Or if someone's saying, like, I'm having palpitation, oh, that's physical health. But, like, they do not know, but, like, this person might be, like, having anxiety attack. So I think in the nursing curriculum, we always talk about holistic care. But there's always that divide about physical and mental health.
Okay.
And my vision has always been, like, to treat an individual as the whole self, not rather with their symptoms, but, like, understanding the individual. And that's how, coming in the NHS and having been able to actually work in LSCft, there's a lot of work that we're doing to ensure that, like, we see the individual as a person, but rather not because of their diagnosis, not because of their the symptoms that they've got, but, like, understanding the whole person. And that's my vision, to kind of like continue the understanding that, like, if we will treat someone, we have to treat them as the whole self. Either in their mental health, physical, their social problems. There's a lot of things that we can actually do. My second vision will be for our workforce.
Yeah.
I'm very, very passionate with career progression, supporting individual to get into the next stage. I think this is kind of like a reflection that it took me almost, I will say, around 8 to 10 years before I went for my first Band 6.
Okay.
But nowadays, with the support that the Trust is actually offering, we're seeing more individuals, either homegrown talents or internationally educated and recruited nurses. We're seeing them to kind of like progressing into their next level within like 6 months or 2 years. And I think I always believe that like skilling up our staff, having that kind of like skilled up, compassionate workforce, we will continue kind of like delivering this best possible care for our patient. And I think that my other vision is like, this is a selfish one, will be for like not just the Filipino healthcare workforce, but like the international nursing workforce across the countries to kind of like see more progress in their career. There are around 45 to 48,000 Filipino nurses registered in the NMC here in the UK, and yet like there's only one CNO.
Yeah.
And my vision as the president of the Philippine Nursing Association UK as well is like to have more individual to get into that ladder, to get into that exec role, and to influence the agenda of like providing the best care that we can offer to our patient and our community.
It's fantastic. And if you were talking now, if there's a I don't know, some that's thinking nursing is maybe the career for me, or LSCft is maybe the career for me, why should they come and work for you with your chief nurse?
I think remove the title, remove the banding. I think what I want people to actually see is like the passion of like why nursing is very vital, why nursing is a very good career, because it doesn't just give you kind of like the financial, like the salary, but like it's developing yourself. Like being a nurse, being a mental health nurse, it actually helps me to kind of know more about like my skill set, know more about like my strength in supporting others. As I said, like in the Philippines, nursing has never been a profession. It's always been seen as like it's your commitment. You want to do it. And why LSCft? I know I've been in LSCft now for the past 18 months, that long.
Wow, it feels a lot longer
but
than 18
I
months.
always say, and I've heard it many times, that like coming up, like living in London for the past 24 years and coming up here, I will say the friendly, supportive help that I've received from colleagues, from an admin support worker, or from our colleagues in health estates and from the exec level. I think I've been well supported. I've been well accepted and respected by colleagues. I will encourage more to kind of like go to nursing and come and work to LSCft, because I'm confident that like as an exec, as a board, as a community of clinicians here in LSCft, it's like I'm confident that we're offering that best support for them to kind of like settle in their work, as well as like supported to go to their next level of their career.
That's fantastic. Thank you so much. I hope that's been really interesting. It's a snapshot into Oliver and how he came to be our chief nurse here at LSCft, and clearly you can hear there's a real passion for nursing and quality. So have a look on our website if you're interested in any vacancies we might have. It would be great to welcome you into LSCft. And thanks very much, Oliver.
Thank you very much.